Welcome to the Holistic Health Podcast, where we delve into topics that bridge wellness and science for the skin, gut, mind, body, and soul. This podcast is brought to you by Gvoam, where we believe that each of us has a unique ecosystem and path to reach our full vitality.
I'm your host, Dr. Sivamani, an integrative physician and an Ayurvedic practitioner. Gvoam is the notion that our Jiva, the Sanskrit word for vitality and the essence of life, merges with our many ecosystems that compose our biome to form our unique Gvoam. This podcast is meant for educational and informational purposes only. None of the information presented here are a substitute for professional medical care, and this podcast does not constitute medical advice. If you have a medical concern, please consult with your physician. Namaste, and welcome to another episode with us at the Holistic Health Podcast. And I am talking to a guest that we've had before, and she is so eclectic and so interesting that we didn't get a chance to talk about all of the things that she had knowledge on. And if you haven't had a chance to check it out, I'm talking to Dr. Leslie Korn, and we did a podcast earlier on touch therapy. You should go back and listen to it. It really puts touch therapy into perspective. But for this podcast, we're going to be talking about nutritional therapies and how that might tie in with mental health. And to introduce Dr. Korn, she specializes in nutritional and integrative medicine and looks at the treatment of areas like depression, anxiety, insomnia, PTSD, chronic digestive problems. She's been practicing for well over 40 years, started in the urban centers of Boston. Now she's been in the jungles of Mexico for over 25 years and has been doing quite a bit of work and body work. But we're going to be talking to you, Leslie, today about your functional nutritional background. So thank you for joining us.
Pleasure. Thanks for inviting me.
And maybe we can just jump right into it. So what got you interested in nutrition? And because you've done quite a bit of work, where did the nutrition education come in, and how have you built this into how you see your clients and patients?
Well, I was very lucky to begin my work in the area of nutrition in two different areas. As you mentioned, we talked about polarity therapy and Ayurvedic medicine in our previous discussion. And there's a whole component to that work that involves vegetarian nutrition and the concept of detoxification. And so I spent many, many years practicing that personally, because I do believe that we're our own best laboratories. And before we advise anyone to do anything, we better try it out ourselves and really experience it. And so that also combined with living in the jungle and really being exposed to herbal medicine, plant medicine, really the role of nature. And so all of that came together for me. I have a passion for the study of ethnobotany, the cultural use of plants and herbs, and really have practiced integrating these methods for many years. However, after I left the jungle, I went back and I wanted to understand the biomedical science, not just the traditional medicine science, the indigenous science, the cultural science and knowledge, but I wanted to understand the biochemistry. And one of the important things that happened to me in the jungle is when I was there, I noticed that every Sunday, the men would slaughter a cow. And one of the men would climb up a papaya tree and take down several green papaya and slice the skin off, and out would ooze this white sticky substance. And he would then lay it, substance down, on the beef in order to tenderize it. Well, I was fascinated by this process. And when I returned to what I like to joke about is the jungle of Boston to study.
That is a jungle.
It is a jungle, same, different, but similar. I studied the papaya. And I studied what this is called. It's a proteolytic enzyme called papain, which is used as a meat tenderizer. I know no one is anymore buying Adolph's meat tenderizer, but that's what was in it. The really interesting thing about this traditional use of papaya is it illuminated the medicinal qualities of this fruit in the green stage. And today we use proteolytic enzymes to treat cancer. We use it to treat inflammatory process. We take it after a hard workout to reduce the inflammation of working out. And it's one of the mainstays of my treatment when I'm working with people who are depressed, because we know that depression to a large degree is from an inflammatory process in the body. So you can see how everything kind of worked together from the jungle to the jungle, and understanding the wisdom of traditional indigenous science and the wisdom of biomedicine in helping us understand deeper levels of it.
I love that, from jungle to jungle, back to the jungle, and again to the jungle. Now that, since we're talking about nutrition, give us a little bit of insight into what's the connection between food and mood. How does nutrition play into our mental health?
It totally plays into our mental health. It is absolutely 100% vital for our mental health. And I guarantee you, if you experience depression, anxiety, insomnia, what's often called ADHD, even in your line of work, as you well know, skin health, and skin health as it's related to emotional health, it is so vital that we have proper nutrition. And what do I mean by that? I mean authentic nutrition, whole foods nutrition, not packaged foods, not dead foods, not foods with additives or coloring agents, which just excite our chemicals in our brain and make us want to jump off the wall because we're so stressed out. I'll give you one of the most important areas for intervention that's very simple. Is we see it in our children and we see it in adults, is regulating our blood glucose levels. If we're eating too much sugar, refined carbohydrates, it's like we're injecting a drug into our bloodstream. We feel great for about an hour and then we plummet. We become irritable, cranky. We might even become dizzy and shaky, have kind of rubbery legs, and we want to scream at someone. And this goes on all throughout the day. We're up, we're down, we have fatigue. Let me grab coffee and a donut. Oh, my energy feels great again. Oh, it's dropped again. And we live these kinds of cycles. And this doesn't stop when we go to sleep. And it's what often contributes to what we think of as type 2 insomnia, where you fall asleep okay, but you bolt awake at 3 a.m. So what I recommend to people is that they begin to think about, what did nature give us? And in what form does nature give us? Nature doesn't give us fruit juice with all the sugar. Nature doesn't give us refined sugar. Nature gives us an apple or grapes or a papaya. Nature gives us sugar cane, and sugar cane never gave anybody diabetes. Why? Because nature gives us sugar wrapped around fiber and minerals, everything that balances out. And that's where I ask people to begin. Think about what's natural and authentic, and think about what's refined, synthetic, and really concentrated in a way that can become really poisons to us.
Yeah, I mean, the kind of food that we eat is quite processed sometimes, especially in the Western cultures. Raises a question about the connection between nutrition and mental health. So I wanted to ask you, do you think nutrition drives mental health, or is it vice versa? Because we see this when people become more anxious, or if they become not necessarily depressed, but have depressed moods or depressed thoughts, or they're going through something that's a little challenging. Sometimes people will turn to food, and it won't necessarily be healthy foods in that kind of a case where they're trying to comfort themselves. How does this conversation occur? I'm sure it's both ways, but do you find that one drives the other more, so that you start at one as the starting point?
I think it's a fabulous question, because I do think it's bidirectional. It works both ways. So let's take some examples. One of the things that was a fascinating discovery during World War II about the role of gluten and depression and even psychosis. During World War II, there was a wheat shortage in Great Britain. And one of the side effects of that wheat shortage is that there were no breads and wheat porridges to give to people who were inmates or mental health patients in the hospitals in the asylum. And what happened? 50% of them got better. Why? Because they were allergic to gluten. And gluten is a very scientifically proven cause of depression, anxiety, dementia, cognitive dysfunction, along with psychosis. And so here you might say that exposure to certain foods that one is sensitive to can drive mental illness. And then we can miss the cause. And then we can, as we do today, do a lot of very harsh treatments with medications, most of which don't often work for treatment of mental illness. Now, let's take an example of someone let's the opposite direction, someone who's had a very traumatic experience in their life. And one of the ways that they calm themselves down is they eat lots of soothing foods. And so they do what I call is they're self-medicating with food. Now, there's nothing wrong with self-medication as long as we're medicating with healthy foods. And that's what I teach people. It's the principle of substitutions that I talk about in my book, The Good Mood Kitchen, which is it's okay to say, I'm anxious, I'm feeling distressed, I can't sleep. But instead of going for the French fries or maybe even the whole wheat toast, what can I eat? Can I bake some sweet potatoes and make a fresh mayonnaise, for example, rather than a store-bought canola oil? Can I improve the quality of what I'm eating? How about instead of going for an Almond Joy, a chocolate bar, I teach people how to make their own candy using all natural ingredients. And there are no better ingredients to soothe you than chocolate, almonds, and coconut.
I don't think anyone's going to argue with you on that.
Exactly. And that's why also with kids who are addicted to sugar, and then the school system wants to put them on Ritalin. And I say, forget that. They need eggs in the morning. They need oatmeal. They need good quality food. They need good quality sweets, no refined sugar. And then let's decide where their problems are coming from. And oftentimes they're cleared up entirely.
Now, this is something that I think a lot of us have wondered about. One is the connection between food and mental health. But what you're talking about is not just looking at what are the side effects and what is like being a passive observer, but how do you take an active approach at redefining that relationship? So what are some of the approaches that you take with nutritional therapy? What are some of the interventions or conversations that you might have as part of re-engaging the relationship with nutrition?
Yes, because there's a saying, asking someone to change their diet is like asking them to change their religion. It's not easy, and we don't want anyone really telling us. I'll give you an example. Joe came to me not long ago because he was having both depression, he was aging, he had arthritis, he had some belly aches. He said, "Oh, please, Dr. Korn, don't make me stop eating my hot dogs and sauerkraut." I said, "Joe, I'm not going to stop you, but how about this? Rather than this hot dog that's got sugar and color and additives and this, worthless sauerkraut you're buying off the shelf, let's go to the farmer's market, get some fresh sauerkraut with fresh probiotics in them for your gut. That's going to help you relax. It's going to lift your mood. And then let's get you a pure beef hot dog. And then, of course, Joe, I want you to start eating some almonds, a very important antidepressant nut. And let's get you going on making some quality substitutions." So part of it is, in order to be able to make these changes, we make them slowly. We find better quality foods that satisfy our taste buds. But then we've got a few things that I think are easy to do right off the bat. One of them is to change out the quality of the oils that we use and the fats that we use. Because remember, I mentioned that one of the biggest factors in any kind of mental illness, as well as physical illness, and you know this in your own work with the skin, is inflammation. If we can reduce inflammatory process, and what's the biggest cause? Poor quality oils. So I always recommend a good cold pressed sesame oil, a good cold pressed olive oil. raw butter, ghee. These are good quality fats. And I also like to supplement with fish oil and black currant seed oils. And the fats are going to support the brain. They're going to support every aspect of health and get rid of these corn oils and safflower oils and all of these canola oils. They're actually doing harm, and of course throw out the margarine. So I find that it's not too big a leap to give up one thing like that. No one's ever said to me, "Oh, Dr. Korn, please don't make me eat butter." Basically, what I'm saying is it's good for you, so eat it, or eat ghee if you're sensitive, and ghee's a wonderful food anyway. So that's where I start with people. And then the next step is I ask people to start paying attention to how food makes them feel. If you have a hamburger and French fries for lunch and you want to fall asleep at 1 o'clock, and then you want to grab a cup of coffee, there's something wrong with that picture. So I teach them about a power lunch. And what gives us power and energy? Protein and vegetables, not the refined or the starchy carbs. Those you can have at night when you feel like relaxing and want to go to sleep. So that's where I begin with people.
I think this is wonderful, the way you're taking us through your different approaches. But one question I have there is, there's so many different ways of experiencing changes in mood or shifts in mood or, mental health issues that may come up. For example, if someone has a depressed mood or depression versus grief versus anxiety, or if they're dealing with things like obsessive compulsive disorder or just constant fixation on things. How do you alter your therapies, or do you, so that they can be tailored to each person's unique mental situation?
You really hit it right on the spot because it is about individuality. Some of us are vegetarians biologically, and some of us are carnivores biologically, and some of us are in between. And the key is knowing biologically and genetically. Let's take, for example, the Inuit in Alaska. They evolved genetically to eat lots of fat, some animal protein, and low carbs. But let's look at the birthplace of vegetarianism in India, where it's a tropical climate filled with fruits and vegetables, legumes, and grains. And so part of the first step is for us to think about, what is my body need? Just like we pick an octane for our car, whether it's a Volkswagen that can drive anything, or a Jaguar that needs high octane, or low octane, it's what does my body need to function best? And that means body and brain. And that's rooted in culture and genetics. And so I teach people, and we do laboratory tests for that. And so once you understand that, then you're optimizing your engine. Now, in addition to working with diet and food, as you point out, sometimes there are significant symptoms for which we need what really are macro doses or large doses of nutrients. You mentioned OCD, and we find a lot of success using what are called the serotonergic herbs, 5-HTP, inositol. There's a great deal of science now suggesting that mitochondrial function in the brain, phospholipid, the communication between fat and the cells and the chemicals need to be enhanced. We see this in autism spectrum as well. And that's where we take many, many people off of milk proteins and gluten proteins. So not only do we look to improve diet quality, improve and tailor the mix of protein, carbs, and fats that each person needs, and how much of it is plant-based and how much of it is animal protein-based, but then we supplement with very specific supplements. And I'll give you an example related to your work. And the kind of work you're doing is so important because it's so needed. I treat a number of people who are depressed, who have skin problems. And one of the things that I find is they're very sensitive to milk proteins. And as you know, only a very small percentage of the world can actually digest cow's milk. And mostly they're from Scandinavian countries. very, very low percentage can really utilize that. But also we see this combination of depression and acne in a lot of teens. And this is where we help them regulate their diet, reduce the inflammatory foods, and then I like to supplement them with black currant seed oil or a borage seed oil, which is very rich in what's called gamma linoleic acid. And so it's that kind of a combination that then augments whether they're doing counseling or psychotherapy or meditation or yoga to manage their stress response.
This is such a needed conversation because I think when we think about foods, sometimes we don't realize how much they impact us. And just looking at the kind of foods that we eat, your comment about how we may have evolved, that is a fascinating one. Just to think about the fact that different ethnicities or different regions of the world probably had different resources around them. And your body naturally will tend to adjust and evolve to be optimized there. How do you think the globalization of trade and having the ability to have food at a moment's notice has changed the way that we think about nutrition? And embedded in there is, does that make it more difficult for us to turn off processed foods or turn away and go towards something that might require more work, where previously it was just part of the day's work, but now you have this option of a quick bite versus maybe a little bit more energy to get a bite that's maybe particularly wholesome?
Well, you've heard of the SAD diet, the standard American diet that makes us sad.
Oh man, there's no better way to say that.
I think globalization has frankly been a nightmare for our diets. As refined foods have traveled the globe, we're now seeing for the first time diabetes type 2 and increased levels of dementia in China and in India, who really have taught us a great deal about the role of plants and foods as medicines. And if there's any kind of bright lining to this COVID crisis, I think it's really shaken the earth on its axis, and for all the terrible things about it. I think one thing I've noticed is it's causing people to gather their food locally, grow their gardens, and even begin cooking at home, because cooking has become a lost art in the United States. And what do we do when we cook together? We gather together, we share, we self-regulate, we calm down, and we're engaged in a ritual with each other of nourishment, both emotionally and physically. And so I think that we should really consider, again, what are the foods growing locally in our region? What are the benefits of them, supporting our farmers, growing our gardens? I begin with 4-year-olds, teaching them by growing sprouts. And we can even learn and have these lessons at home now that we're homeschooling so much, just looking at alfalfa sprouts when they grow. And what does that mean? That a seed turns into a green and releases all these enzymes. So at every age, I think we can really learn and benefit from taking control, because I think you really said it when you said we've been almost indoctrinated into thinking that food doesn't really matter. We're almost disconnected from ourselves and the feelings of food. Oh, so I'll eat a lot at Thanksgiving and then fall over and go to sleep. But nothing wrong with that. That's normal. No, it's not. That's an insulin rush that says you're in trouble.
Yeah, one of the things that I think you've reminded me of some memories, even with my mother growing up. And I think it's very, very important that you talk about you getting 4-year-olds growing alfalfa sprouts. I think that's amazing, because I was so fascinated by vegetables, and I was fascinated by growing the vegetables because my parents had a big garden, and I took it for granted, to be frankly honest, for a long time. It was just part of growing up, and eventually I didn't really miss those moments with my parents. But now thinking back, we really got to go pick the vegetables, smell the fruits, cut them, eat them raw, see what it tasted like, almost appreciate the subtle sweetness that comes out of there without the refined sugars. I think it really helps build a palate and understand what a natural taste is, rather than, starting with what an unnatural taste is. And I think you're right. It creates a relationship that's long lasting. Even if you move away from it, say you go into the college years, which a lot of us will start tasting all kinds of foods, which are minimal nutritional value, but maximum social value in some cases. But regardless, I feel like having that early exposure will set the stage for when you want to go back to start eating healthy. You have a basis and you have a foundation there. So I think starting early with kids is so important. So I really appreciate you making that comment.
It's so important what you've said about taste, because do you know that they actually purposefully enhance all of these tastes of these junk foods in order to addict us to these powerful sensations? And the
That I'm
example,
not surprised by at all.
yeah, the example I use is celery. When you eat a stalk of celery, it's very salty. It's very high in sodium. But if you're used to eating high salt foods, you're not sensitive enough to taste it. And so part of what these foods are doing to us, and this brings us back to, in many ways, Ayurvedic medicine, part of what these intense foods are doing is they're dulling our senses. They are limiting our capacity to truly enjoy the range of sensory experience and therefore consciousness of ourselves and of our relationship to the earth and the cosmos. And so that's why it behooves us to explore our whole beingness with foods, not only our personal likes and dislikes, but texture and flavor. One of the initial exercises, it's a mindfulness exercise I do with patients, is I ask them to put a raisin in their mouth and close their eyes. And everybody who's listening can do this. And then feel it in your mouth. You don't want to swallow it, but move it around with your tongue and feel the texture, feel the sweetness. How does it feel in the front of your tongue or the back? Feel how it changes. Just this kind of bringing attention and awareness is going to be relaxing us. It's going to let the digestive juices flow, which means we digest our foods better. And it's going to enhance our awareness of what we're doing and how we're consciously self-medicating.
That is such a lovely way to put everything into perspective, because at the end of the day, food is an experience, and experience drives our moods, and moods drive how we have a relationship with food. It's a beautiful circle. So Leslie, can you tell us, how can we find you if, after this podcast is done and we want to learn more about what you're up to? I know you've written quite a few books. Are there any books that tie into nutrition? And then tell us about your websites too.
Thank you so much. Well, I have written a number of books, and I wanted to joke with you that you can find me over the Brainbow, because I created something called the Brainbow Blueprint. And I've got some hour-long online courses for people. And if you're a professional or a serious student of nutrition, I've got a number of 19, 20, 25-hour online courses and certification in these approaches. And I've written a book called The Good Mood Kitchen, which teaches some of these principles, and it's very expansive, meaning you'll find yourself in there no matter what your particular orientation. I'm not ideological in that sense. And if you're looking for a textbook, Nutrition Essentials for Mental Health also has recipes, but also protocols for treatment and nutrients. And then I've got lots of other cookbooks and books on trauma, and even a multicultural workbook, because I'm totally committed to really our cultural diversity and how we need to embrace that and claim it and learn, as you said, from your own upbringing, the kinds of infusions you learned that have set you on your path.
Leslie, this has been amazing talking to you. Thank you for sharing all those resources as well. I do view you as a Renaissance woman in so many ways, and it's almost fitting that you are in the jungles of Mexico. I can't picture you anywhere else except there. And hopefully once we're all through this COVID environment, I'll be able to visit you down there. I think it would be fascinating to just spend some time seeing what you do. And thank you again for joining us on the podcast.
My pleasure. Thank you. And you're welcome anytime. We'll make a coconut pineapple smoothie.
This is the Holistic Health Podcast, brought to you by Gvoam, where we believe that cultivating a healthy ecosystem unique to you is important to living vital and living well. Don't forget to like, rate, and subscribe to our channel, and be sure to follow us on Instagram and Facebook, and visit us at gvoam.com. Check out our membership options to take your health to the next level.